Well, January is National Human Trafficking Prevention Month, and we are highlighting a program making a big difference for victims. It's a medical safe haven that is providing confidential entry points for anybody who needs help. And to talk more about this program this morning, we're joined by Dr. Ron Chambers with Dignity Health. Thanks for coming in today. This clinic, this program is super unique in terms of what it's providing and how it's connecting the medical providers with victims.
Yeah, it is unique. You know, I think one of the issues around trafficking is that a lot of people have a lot of misconceptions about, you know, when somebody gets out of trafficking, whether it be through law enforcement, self-referral, whatever it may be, that, you know, if they're away from the trafficker in a safe house, whatever it may be, the job's kind of done and they're on a road to recovery. Right. And quite honestly, it's much more complicated than that. We did a study at one point that showed about 85% of our young women sex trafficking survivors returned to their trafficker in very short order after being removed from a trafficking situation. And what we found over time is it was because we were really not helping them mitigate complex post-traumatic stress disorder, trauma bonding, these things that would pull them back to that trafficker. And that's where medicine can really step in and have kind of a crucial role in helping our community partners get these patients on longer-term roads to recovery.
And disclosure, Ron and I are actually really good friends. Our kids play sports together, so we've actually talked about this a lot. And you have told me that even when you started working with victims, even you were surprised by how deep that connection could be between the trafficker and those being trafficked.
Yeah, and again, that's kind of, again, goes into that misconception. It's disturbing, but you know, when we think about when this starts for many of our patients, it's not uncommon that when I'm talking to them, they tell me they were first, you know, sold for sex when they were 5, 6 years old. And so this has been their existence in their life throughout their entire adolescence, you know, up into their teenage years and beyond. And so for that person, what that's done and how that's tied to them, to that trafficker, it can be very deep and ingrained, and it's going to take a lot of work to break those bonds.
And so that concept of being trauma-informed, not only as a society, but also within the medical profession, how critical is that then to trying to help people?
I think it's incredibly important, and quite honestly, there's an incredible lack of any kind of education and training within our healthcare system on working with this patient population. Now, we've, over the last decade, provided about 8,000 patient visits in our outpatient clinic. If you add in labor and delivery inpatient, probably over 10,000 patient encounters for people that have experienced trafficking. And what we found through that time, we published a paper that showed that if those same patients came to us and were seen by our medical providers, 85% previously returned to their trafficker. Their success rate of
85%?
85%.
Wow.
85%. But if they were seen in our clinic by our providers, their success rate of getting out and staying out of trafficking went up about 437%.
It's amazing.
So that's a huge outcome in medicine.
That is a huge outcome. Let's go ahead. We have a graphic we want to put up just to get people a little bit more information about this. Medical Safe Haven, confidential for anybody who is looking for support services, a way to connect with advocacy, housing, long-term resources, etc. And you can also get more information by scanning the QR code. Thanks for coming in today. We appreciate it.
Yeah, thank you.
You bet.